Physiological strategies. Hydration. Recovery is defined as a return to normal condition or state of health, mind, or strength. For athletes, recovery is usually a multifaceted approach aimed at returning the body to pre-competition or training state. This ranges from physiological strategies, neural strategies, tissue damage strategies, and psychological strategies. Today, however, we'll be focusing on hydration as a physiological strategy. Why we need to hydrate. As an athlete exercises, the body falls out of homeostasis in the attempt to cool down the body. Thus, perspiration is experienced and the body experiences fluid loss. Without going into too much detail, there are a few things to note on dehydration, as other parts of this resource today will explain this in much more further detail. The amount of fluid loss varies from one individual to another and is influenced by altitude, temperature, exercise intensity, exercise duration, and sweating. Symptoms of dehydration after exercise include increase in pulse rate, an increase in core body temperature, a decrease in blood pressure, a decrease in water in the cells, and a gradual decline in circulatory function. It is also important to note that urine that is dark in color is a good indicator of dehydration. If this occurs, fluid needs to be consumed until urine color turns pale or slightly yellow. Weight measuring. It is a common practice for athletes to monitor weight changes during sessions to determine individual fluid losses. Elite athletes weigh themselves before and after exercise, the weight difference representing fluid loss. Extended exercise in normal conditions can result in the loss of 0.5 to 1.5 kilograms of fluid per hour, or more than 2% of body weight. In this case, drinking 600 ml for every half kilogram lost is recommended. When designing a rehydration protocol, consideration needs to be given to the next time the athlete has to train or compete. The general recommendations for fluid replacements are a replace of 120 to 150% fluid deficit over the next 4 to 6 hours. These guidelines should be translated into a practical and individualized fluid plan to ensure that fluids are replaced effectively before the next training session. It is imperative that athletes are not fluid loading unnecessarily or at risk of disrupting their sleep due to ingested large amounts of fluid before bed to meet their fluid targets, as sleep interrupted by multiple pee stops is not conducive to recovery. Other fluids to rehydrate. Sport drinks are one other fluid or type of liquid that can help rehydrate the body. The inclusion of sodium within post-exercise recovery fluids may assist in replacing electrolytes lost in sweat. This is because sodium and potassium present in these drinks stimulate the thirst mechanism, which assists athletes to drink more liquids. Consuming electrolyte-containing fluids may also assist in effectively replacing fluids by assisting the retention of fluids ingested. The amount of sodium to rehydrate effectively has been shown to be 50 to 80 millimoles. This can be achieved by consuming fluids with this concentration of sodium or by adding extra electrolytes to commercially available sport drinks. Alternatively, foods that contain sodium can be consumed with recovery fluids to ensure adequate electrolyte intake. An athlete's post-exercise fluid plan should be devised to meet an individual requirements and ideally provide the athlete with other nutrients to meet additional recovery goals. Real fruit drinks and juices and milk drinks are encouraged along with sport drinks such as Gatorade because of the potential to replace a full range of nutrients, including carbohydrates, vitamins, and potassium. Cow's milk and soy has been shown to be effective hydrating post-exercise beverage. Milk has similar electrolyte composition to sports drinks, with the added benefit of carbohydrate and protein to assist with meeting other recovery goals. Together in all, these are the strategies that help rehydrate an athlete.